Mr. Hernandez,
Yes?
the doctor will see you now. Please follow me.
Mr. Hernandez? Yes, Doc. You're welcome. Please sit. How have you been, sir? Fine. Except for my son. Mr. Hernandez, your son is diagnosed with pneumonia. Pneumonia? But Doc, that was the last infection he was treated. Does it mean it was not properly treated? May I ask you some questions? Was your son admitted in a health facility? Yes, Doc. While on admission, did he make use of a medical ventilator? Medical ventilator? You mean the breathing machine? Exactly. He used it all through his admission in the hospital. How long was he admitted? 2 weeks. When did you notice the first sign of this infection? 4 days after he was discharged from the hospital. Mr. Hernandez, your son has a hospital-acquired pneumonia. Meaning, he wasn't properly treated? No, not that. The infection he had before was a community-acquired pneumonia, otherwise known as aspiration pneumonia. It is different from the hospital-acquired pneumonia. I'm not sure I understand you, Doc. Let me explain. Your son's earlier infection was properly treated. But it is possible he got infected from the hospital while making use of the medical ventilator. You mean he got infected with a different kind of pneumonia? You could say that. But what is a community-acquired pneumonia? It refers to pneumonia contracted by a person outside the healthcare system. Does it mean that any infection or sickness occurring while in the healthcare facility is hospital-acquired? No. A hospital-acquired infection, also known as nosocomial infection, is an infection occurring in a patient in a healthcare facility in whom the infection was not present or incubating at the time of admission. In other words, the infection is unrelated to the original illness that brought the patient to the hospital. The most common type of the nosocomial infection is the urinary tract infection, contracted from the use of an indwelling bladder catheter. There is also the surgical site infection caused by touch contamination. And of course, the lung infection, which is the pneumonia, contracted from the use of ventilators in the intensive care unit. Another criteria for classifying an infection hospital-acquired is that the infection must occur up to 48 hours after admission, up to 3 days after discharge, or up to 30 days after a surgery in a healthcare facility. But why my son? Patient susceptibility. Surgical and therapeutic procedures such as catheterization, intubation, ventilation, suction and many others increase a patient's susceptibility to these infections. There are environmental factors which include crowded conditions within the hospital, inadequate environmental hygiene conditions, improper waste disposal system, frequent transfer of patients from one unit to another, and concentration of highly susceptible patients in one area. Are there any microbial agents that cause this nosocomial infection? Yes. The bacteria, which includes the commensal bacteria, which may cause infection if the natural host is compromised. The pathogenic bacteria that causes infection regardless of the host status. There are also the viruses, that is, the hepatitis B and C viruses, rotavirus, enteroviruses and many others, which can cause an infection through hand-to-mouth contact and via the fecal-oral route. Then, the parasites and fungi. With many parasites and fungi as opportunistic organisms, they can cause infections during extended antibiotic treatment and severe immunosuppression. So, what do I do now? Your age makes you at risk of contracting this infection. Therefore, you must ensure your son covers his mouth and nose with a tissue when coughing or sneezing. Thereafter, use the nearest waste receptacle to dispose of the tissue after use. Also, perform hand hygiene, for example, hand washing with non-antimicrobial soap and water, alcohol-based hand rub, or antiseptic hand wash, after having contact with respiratory secretions and contaminated objects or materials. And my son? What do I do to him? Ensure to give him antibiotics and enough bed rest. Also, healthy diet and fluid intake is encouraged. Thank you, Doc. You're welcome, Mr. Hernandez. May I go now? So tired.